Within the first year, we've done manual handling within the clinical skills lab using the various equipment that would be used in practice, such as hoists, stand-aids, slide sheets, and so on, as mixed field groups with adult nurses, mental health nurses, and child nurse students. We've also done basic life support, again on mannequins, using the various equipment such as defibrillators that would be used to save people's lives. We've done communication techniques, such as motivational interviewing and assessment skills within the communication booths, and in the skills lab as well, assessing adults and children, as well as in the second year then more advanced clinical skills practice again in the skills labs. I think they've all been enjoyable for different reasons. Some of the sessions, such as maybe using the communication booths, are more enjoyable to me personally because they're going to be focused around mental health, which is what I'm studying. But when you come into these rooms and use the sim man, sim mom, sim baby, that's quite a strange experience at first. But when they respond to things you're doing, that is really enjoyable, and everyone enjoys it. You're in a mixed field group with students from other fields who all know something different and have got different maybe bits of knowledge. You all come together and use them. Using the manual handling equipment as well was also really enjoyable, something I'd never done before, but it's really useful, and to know before you go into practice how to use them safely, and I had no prior knowledge of that beforehand. As a nursing student, over the 3 years, you've got a clinical portfolio that needs to be completed between you and your mentor when you're on placement, and this is something you take with you over the whole of the course. The competencies in there range from working within the NMC Code of Conduct to safely administering medication, care planning, covering everything you need to do as a nurse. Coming into the clinical skills lab, you are taught some of the skills that you would need in order to achieve the competencies in a safe environment where if you make a mistake, you're not actually going to hurt anyone or put any patients at risk of harm. In the first year, we had a skill session where we were doing injection technique and aseptic technique. So I had never given an injection before this to a patient, but using equipment and props, we were taught how to give an injection safely. I then went on to placement and experienced giving an injection to patients, and I could look back on the preparation we'd had in the skills lab, confident that I was able to do it safely, talked through the preparation with my mentor, and she was then confident I'd be able to do it safely, and that was really useful. But I think it's important to understand that you're coming into a 3-year degree, and it will take, it's a process of learning. It will take time to transition from being a student nurse to qualified nurse. It's 3 years, and then it continues learning. You continue learning after that as well. The first few weeks of theory block aren't going to be teaching you advanced clinical skills. You're not going to be meeting any patients. You're going to be learning theory, and sometimes you might think, how is that theory related to me being a nurse, whatever field of nursing you're going to be studying? But as you progress through the course, as you learn more theory, as you go through your placements, that theory you learned in your first week, 2 weeks, 6 weeks, 12 weeks, you start to link that to practice. You start seeing situations where actually, yeah, that is important. I understand why we did that in year 1 or year 2. And that's something which I think is important to understand, that everyone's going to have a different expectation as to what the course is going to look like. And it's going to be the same course for everyone. You're all learning together. You're all learning the same things at different paces and at different levels, and taking it at your own pace to make sure that you're the best nurse. And I think that's something which you don't come into the course realizing, that it's a gradual process of learning that will continue for the rest of your life.